Randy, Bethesda Hospital has treated more than 400 people for COVID-19, and right now the 90-bed hospital is nearly two-thirds empty. But they are hoping that this recent trend in positive cases in Minnesota does not eventually lead to more hospitalizations. For 100 days, M Health Fairview Bethesda Hospital in St. Paul has treated COVID patients and only COVID patients. And hospital leaders say the results prove transforming it into a 90-bed specialty hospital was worth it.
I can't help but think that, like a heart hospital or a children's hospital or a cancer hospital, the outcomes are as good as they are because we're taking care of the same kind of patient and doing it the same way.
Dr. Jeffrey Chipman, the head of the Bethesda ICU, says patient survival rates are extraordinarily high.
Move it around and make sure it's not going to fall off.
And doctor and nurse infection rates remarkably low compared to other hospitals around the world.
I think it's because we take care of the same patient the same way, and we do it aggressively.
For example, after learning putting patients on their belly or side in the prone position is helpful, they've turned it into a twice daily routine, ICU-wide.
They've become experts at it, and I think that's affected the way patients are cared for there, and it has improved their outcomes.
Chipman believes the negative airflow installed at Bethesda, which blows the germs from the ICU outside instead of circulating inside, has prevented infecting staff.
I think that's one of the amazing things about the story. I think our results show it with such low healthcare transmission rates.
They've learned from their patients and from their treatments. Those with hypertension, obesity, diabetes, and old age tend to do worse with the disease. They've gotten very aggressive in treating blood clots in patients. Looking forward to the fall, Bethesda will stay open and ready.
We are prepared for a second wave. We're hoping there isn't one.
So as mentioned, this recent spike in cases has not translated to a rise in hospitalizations, and they believe because a lot of these new infections are happening with younger people. But what they're worried about is that the younger people could infect their older relatives, and in a few weeks it could lead to a rise in hospitalizations. That's what they're hoping does not happen. Back to you.
Really interesting, Lou. Thanks so much for the update.